Hi, and welcome to this clinical case on colon cancer. So let's jump straight into the case. We have a 70-year-old male presenting with a 3-month history of fatigue and weight loss, with more frequent opening of bowels. The patient is cachexic and anorexic, and on colonoscopy, we find adenocarcinoma, we find mucosal lesion at the descending colon, and the biopsy shows adenocarcinoma, which extends through the muscularis propria. Histopathology confirms 2 lymph nodes are involved, yet there is no distant metastasis. Which management plan is most suitable? So, what do we have? We have an elderly male who is presenting with constitutional cancer signs and symptoms. He's got fatigue, weight loss, cachexia, anorexia, and now we also find on colonoscopy there is a mucosal lesion at the descending colon. This is exophytic, by the way. And we now know there's adenocarcinoma. And why is this important that it extends through the muscle layer? This is important when it comes to staging this cancer and the treatment. Histopathology confirms lymph nodal involvement, which is also important. Remember, whenever we have 1 to 3 lymph nodes which are involved, this would be considered stage 3 or Duke's criteria C. Duke's criteria C. Which management plan is most suitable? Obviously, this is a confirmed case of colon adenocarcinoma, and we can work out the Duke's criteria. So, the treatment is a left hemicolectomy and post-op chemotherapy. We're going to give this patient chemotherapy because there was mention of lymph node involvement. Whenever lymph nodes are involved, we start to treat with these chemotherapeutic drugs. Left hemicolectomy, why is this the appropriate surgical treatment? Because tumours of the distal transverse colon or the descending colon do typically require a hemicolectomy, and if you just imagine, here's the cecum, here's the ascending colon, the transverse colon, the descending colon, the sigmoid, the rectum, and the anus. So here, if it's up to here, this would be, so this is the patient's right side and this is the patient's left side. If the cancer was found here, that would obviously be a left-sided hemicolectomy, left-sided excision of the hemicolon. Patients with Duke stage C, which means involvement of the lymph nodes, should be offered adjuvant chemotherapy and not radiotherapy. So we typically do reserve, let me just tell you here, that we do typically reserve the radiotherapy for rectal cancer, so R for R, and we typically do give the chemotherapy for your colon cancer. So how does Duke's criteria progress? So Duke's criteria is a classification for how far the tumour has progressed. So if the cancer is confined to the most superficial cell layer, it's Duke's criteria A. If the cancer has invaded through the wall, through the muscularis, that's Duke's criteria B, as long as there is no lymph node involvement. Duke's criteria C is it spreads completely through the wall of the colon. The cancer may extend completely through the wall of the colon, and most importantly, it's also spread to the lymph nodes. And Duke's D is D for distant metastasis. It can spread to the liver. That's why we want to do a CT scan. CT scan specifically to check for liver metastasis. Duke's A, when it's just superficial, the treatment is usually surgery, and the 5-year survival is quite high at 95%. Duke's B, again, it's just surgery, but as soon as you go to Duke's C, which I told you has lymph node involvement, now you're going to give chemotherapy as well, and radiation reserved for rectal. Now the prognosis jumps down to just 1 in 2 patients surviving the 5-year rate. Duke's criteria D, now you're going to give surgery and chemo. So just one more quick way of remembering Duke's criteria A was that the cancer stayed within the bowel wall and not yet invaded the muscularis or the muscle layer. So A for adjoined to bowel wall. A for adjoined to bowel wall. B extends beyond the bowel wall through the muscularis. It invades the muscle layer and now it's beyond. B for beyond bowel wall. C, remember this is the crucial one which determines chemo, and you can do a preoperative lymph node investigation, preoperative chemotherapy as well if you want. And C is for contiguous lymph node and C is also for chemotherapy. C is for contiguous lymph node involvement, and C is for chemotherapy too. And finally, D is for distant metastasis. Distant mets from the colon to the liver, to the lung, anywhere else. And moving on.